Alright, this is the second video. Uh, like I said, right after I finished the first one, I was going to continue with another video since I found a comfortable position. I'm in a good mood. I have a clear head and I feel capable of talking about it in a more objective way. So, you will find on my channel some videos in which I address the subject of mental health and the subject of depression. That is because I've been struggling with severe depression for 20 years, and I know how hard it is to deal with this mental health issue. And I want to explain to people who suffer from it, or people who have loved ones who suffer from it, how it is to suffer from depression. You're right now on a channel dedicated to pipe smoking, so if I'm smoking this cigarillo and you're not a pipe smoker, I'm sorry if this is a turn off for you, but just try to not not give it any attention, or think that Freud used to smoke lots of cigars. So even though he died of mouth cancer because of it. So, but anyway, my dear people, I can honestly say that uh, this this illness, because it is an illness, um, like I said in the previous video, is so misunderstood and so little known even by professionals that it's just, to someone who suffers from it, it is heartbreaking, because you're trying to find help, and many times, no matter how much effort you put into it, and no matter what you do, you don't really find the treatment, you don't find the cure, you don't find something that can help you get away from it. Also, like I said in the previous video, there are um, two main ways to treat it. One is psychotherapy, the other is psychiatry. It's best that you use them both, but sometimes, if it's a mild depression, let's say mild depression or a mild anxiety, you can treat it just with therapy. If it doesn't work only with therapy, and your therapist suggests that you have to go to the psychiatrist, do it. It's no shame. It's like any other illness. If you have a heart disease, you go to the cardiologist. If you have a mental issue, you go to the psychiatrist. It's no shame. There are incredibly many people out there who suffer from the same thing. Very great people, very intelligent, very respectful, very beautiful people, rich and everything you want, that suffer from the same thing. So it's nothing to be ashamed of. It is not a trace of what's it called? of weakness. It's not about weakness. On the contrary, if you're struggling with it and you're fighting it, that means you are quite strong. And I'm serious, if you are fighting it and you're still here and you're still kicking ass, you're strong. Because this is very, very hard to, how should I say, to manage. Now, I know this, I mean, I know I've been going from one subject to another. I don't have a script written or something to, you know, um, talk in an order. So this is free talk about mental health. Getting back a bit to what I was saying in the beginning of the video. If you're suffering from depression, if a loved one suffers from depression, you must understand that this is not just sadness. This is not just um, a mood. This is something far more complicated than that. It affects you in many ways, not just your emotional state. When you are depressed, you're not just sad. If you Google traits of depression or symptoms of depression, you will see that one of the most common symptoms of depression is a lack of energy, a lack of joy for anything. I will give my example. I received recently a gift from a friend in the pipe community, an incredible gift, and I was in depression. And even though I knew that this is a great um, gift and I should be super happy because I've been after it for so many years, I was numb emotionally. I was numb. I mean, I couldn't enjoy something so big. If someone came to me and said, here's $1,000, do whatever you want, it's a gift, I would still be numb. So that's how depression works, you know? Telling someone, oh, cut it off, just try to think more positive and stuff like that, it doesn't work. It's something that you can't control, or you can, but not so easy, because the mind is very complex, the mind is very hard to control. And when it comes to such things, such emotions, such intense moments, you're not thinking objective, you're not thinking clearly. There is a total chaos inside you that you can barely, move out of bed. You can barely talk or find your words and stuff like that. So depression affects even your 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 memory, your concentration. It affects your concentration a lot. It affects your sleep. Some people with depression can't sleep, or others sleep a lot, like myself. If I am depressed, all I can do is sleep. I'm not even to do the most easiest things. So if, for example, a loved one is in depression, and he says, man, doing that is so hard. Don't think that he's lazy. It's not laziness here. It's really such a lack of energy that you can't, like, it's such a great effort to make the easiest tasks that for a normal person would be like, someone who doesn't suffer from it would think that it's laziness. Yeah, I know, and it sounds like laziness, but it's not. It's, I don't know what it is. I don't know the exact connection of it. But I've seen that many people who struggle from depression, from or were whatever, with depression also have this chronic uh, chronic tiredness. I'm not a native English speaker, so that's why I'm finding my words a bit difficult. But mm, yeah, the way depression manifests itself is in many ways not just not just having a bad mood. It's lack of concentration, is lack of energy, a lack of sexual um, what's it called, sexual activity and libido and stuff like that. um, a lack of interest for the things that used to make you happy, and many other things. uh, and if you think about it, being in such state, if you are not able to get out of bed, how can you be able to go to work for 8 hours and be concentrated on the tasks? It's impossible. That's why many people with depression can't have jobs, or they can have jobs, but um, they struggle much more. Same thing goes with people with anxiety, but that's the subject for another video. um, I will think about other things to discuss about depression, and I will make further videos. But before I close this video, please understand that this is not something simple. It's not something that goes away if you just try to think about it from other perspectives. Although in milder cases it might work. Uh, some therapies will help you learn ways of thinking that will help you, and will help you to control your emotions better. But I believe that in order to find the true cure for your depression is to go and see what made it appear. Because if you're just treating the symptoms, the illness will still be there. You have to go to the root cause and see what's making it happen. Yeah, I'm rambling a lot. I am going to from a subject to another, and I apologize. There are so many things I want to discuss, and I wouldn't be able to discuss in 20 minutes or so. And I'm trying to make short videos in which I will cover uh, as much as I can. Most probably in the future videos, I will be more, let's say, I will be more. God, I hate it when I can't find my words. Organized. Yeah, I hope that I will be more organized, and I will try to note down the subjects that I want to talk about, and I will talk about those, without jumping from a subject to another. But this is, I think this is going to be the beginning of a series about mental health issues. So, with that in mind, be compassionate with each other. Try to understand people who suffer from it. Try to understand yourself if you're suffering from it. Know that you're not alone. Know that there are ways to recover, and be strong. Be strong. I've been where you've been. I am going to be where you are. I know that depression comes and goes, and sometimes it hits you just like a truck. But I also know that I can recover and be back. And so can you. Anyway, I hope this was useful to someone out there. I'm waiting for your suggestions. If you have questions, if you have anything that you would like me to discuss from the perspective of someone struggling with this kind of stuff, and who learned about it from specialists, from professionals and stuff like that, leave a comment, and I'll do my best to answer and explain my point of view. But until next time, take care, be well, and I used to say happy puffing, but now I don't think everyone's going to be a pipe smoker. Just be well and be happy.